performing hand hygiene. Hi there, my name is Britta. I'm a student nurse, and I'm going to take care of your tracheostomy right now. Can you please verify that the name and date of birth on your wristband is correct? Yes, it is. Perfect. Alrighty. And I know you have a hard time communicating because of the tracheostomy, so if you want to give me a thumbs up for yes, a thumbs down for no, and then anytime you need me to stop or you need to take a break because you're having a hard time breathing, go ahead and just do a stop sign like this. Is that okay? Perfect. Alrighty. So as I was saying, the tracheostomy care includes suctioning your tracheostomy, and the purpose of that is to improve your breathing, your oxygenation, remove the secretions inside the trach, and then finally just to make you more comfortable. And the second step of this is to get you a new inner cannula to reduce the chance of infection, as well as cleaning the insertion site of the tracheostomy. And then finally we're going to get you a new collar, okay? Do you have any questions or concerns about the procedure? No? Alright, great. So before we get started, I want to make sure that I provide some patient privacy. I'm going to close the door, and then I'm going to make sure that I have everything here that I'm going to need. So we have a bottle of sterile saline, we have a face mask and goggles, we have a fresh inner cannula, we have a size 12 French suction catheter, and then we have the tracheostomy cleaning care tray. And then at the bedside, we also have an ambu bag, and it's attached to 100% or 15 liters of oxygen. And then in case of emergency, we have a new trach kit, the same size as what's in her right now. We have a one size smaller trach kit, and then we have a new inner cannula as well. And then I'm also going to make sure that the oxygen is functioning. The suction is working. Okay, I'm actually just going to turn the suction to 100 millimeters mercury because that's what's indicated for adults. Okay. And before we do get started, I just need to ask a few questions. Are you in any pain? No? Perfect. And do you have any allergies? No. Perfect. And then I'm going to get a baseline of your vitals. So I'm going to do your heart rate. Alright, it's at 80 beats per minute. Your O2 sat is at 99. Your respiratory rate is at 18. And then I'm going to listen to your lung sounds. Okay, perfect. Do you have any questions before we get started? Okay, no problem. So, as I said, I'm going to wipe down my table with chlorhexidine. And we're going to let that dry for 2 minutes. And we're going to do it once more. Around the edges. And we're going to let that dry for 2 minutes. So I'm going to discard my gloves. And I'm going to do some hand hygiene again, and I'm going to place my supplies here. Okay, so first I'm going to, with my clean gloves, I'm going to carefully open this, and only going to grab the drape for right now. I'm just going to place that aside. And I'm just going to drape this over the patient now, just in case we get any secretions on you. Don't want that actually on you, okay? Okay, at this point I'm going to put on my mask and goggles. And, okay. So now with my still clean gloves, I'm going to carefully open up the suction catheter. And only touching the paper bag, I'm going to attach this to the suction now. And it's going at 100 to 120 millimeters mercury, it's on. And I'm going to place it to the side against the wall with only the white tip peeking out of the paper bag. Next I'm going to grab the basin, still only touching what's inside. I'm going to move this out of my way and place that right there. Okay, so before we get started, I'm just going to pour my sterile saline into the basin. Okay, and I'm going to take off my gloves, perform hand hygiene, And now I'm ready to put on my sterile gloves. Alright, now remember, if you need me to stop at all, don't be afraid to just raise your hand and we'll take a break. Okay. Okay, so I'm now sterile, and I'm going to use my non-dominant hand to remove Miss Elephant's O2 mask. I'm going to use the ambu bag to hyperoxygenate her. Just going to do 3 or 4 breaths with 6 seconds in between. Okay, so now she's hyperoxygenated, and I can still use my clean hand and only touching the white catheter tip. I'm going to wiggle it until the paper comes off. Okay, and now with my sterile hand I will coil it up, and before we stick it in the patient, I'm going to make sure that it's working the way I'd like. So I'm going to suction some water out of, or the saline out of the basin. Okay, it's working. So now I'm going to place it inside the patient until I feel resistance or they start to cough. Okay, so there's resistance, so I'm going to occlude the thing, and then I'm going to start to pull out and twist as I pull out. And we're not going to leave it in the patient for more than 10 seconds. Now if I had to suction again because it wasn't all cleared, I would clear it, as so. Okay, and then I would wait at least 30 seconds to give the patient a break. And but it sounds like we don't need to clear it a second time. And then also at this time I would assess her oxygenation. So she's still at 99, so we don't need a hyperoxygenate her, but if she was a little bit lower, we could use the ambu bag to give her a few more breaths. So I'm going to wrap this up in the hand and discard properly. I'm going to perform hand hygiene, and then I'm going to replace the oxygen mask. Okay. Just going to move this out of the way for right now. Are you still doing okay, Mrs. Elephant? Alright, good to hear. So next I'm going to, I already did my hand hygiene, I'm going to reopen my trach care kit. I'm going to carefully drop in my inner cannula. Perfect. Alright, and next I'm going to do hand hygiene once more. Okay, I'm going to remove her O2 mask. Now we're going to be changing her inner cannula. Okay, so I'm going to do hand hygiene just because I touched the oxygen mask. Okay, so I'm going to put on my sterile gloves once more. Okay. So now I'm sterile, so I'm going to use my non-dominant hand to stabilize the faceplate and remove the old inner cannula. Okay, I can discard that. And still stabilizing the faceplate, I'm going to use my sterile hand, touching only the tip to, oh, before I do that actually, I need to remove the old gauze with my dirty hand. Okay, I'm going to remove that. So I'm stabilizing the faceplate and inserting the new inner cannula, only touching the tip as I was mentioning. Okay, so now the new inner cannula is in place. From now it's a clean procedure. And while this gauze is gone, I'm just going to assess the area. There's no redness, it's midline, there's no signs of infection or rash. Alright, so that's good. Now I'm going to I'll remove the other things I don't need. So I don't need this. So I'm going to pour the sterile saline into the basin. And now I'm just going to clean the area around the site. I'm using, going from the inside to the out. And I'm only going to use one Q-tip per swipe. I might need to get a few extra. Make sure it's very clean. Okay, now I'm going to use the gauze to dip it in the saline and then clean the skin around this insertion site. Oops. Okay. Discard that. And then I had another gauze and I dry the faceplate and the insert and the skin around it. Okay. So now we're going to put on a new fenestrated gauze. I could use a Q-tip here. It's going to be okay though. So I want there to be no bumps in the gauze just so it doesn't cause any skin irritation. You still doing okay, Miss Elephant? We'll get your oxygen back in just a moment. There we go. Okay, so the inner cannula is in. Okay, so now I'm going to replace her oxygen mask. And I'm going to take off my gloves, do hand hygiene, and then I'm going to ask a second nurse to come in and help me replace her collar for me. Okay, so the second nurse came in, she did hand hygiene and put on clean gloves, and I'm going to do the same. Okay, so now I'm going to remove her oxygen mask once more. Okay, and then working on one side at a time, I'm going to undo her collar. And while we're doing this, I'm going to assess for any signs of skin breakdown or irritation from the faceplate or the collar. Okay, the second RN is stabilizing this while I do this. Okay, we're going to pretend that inner cannula did not just fall out. Okay, so we have a new collar on, and I'm just going to make sure that 2 fingers can comfortably fit in there. It's not too tight. I'm going to replace the oxygen mask. Okay, Miss Elephant, are you comfortable? Okay, so before I take off my gloves, I am going to just clean up a little bit. I think I can get rid of that. Okay, and then a few more steps here. So, took off my gloves now, and I'm going to do hand hygiene, and then I'm just going to do a quick assessment. Miss Elephant, was that okay? Did you tolerate that okay? She gave me a thumbs up. Alright, and then I'm going to retake your vitals. I'm going to take your heart rate. It's still at 75. Your oxygen is back at 99 again. Your respiratory rate is still 18. And finally, I'm going to take a listen to your lung sounds. Okay. I'm going to make sure that the ambu bag is still here. There is a clean suction catheter on the wall with suction that's still functional. Oxygen is still good. Alright. Your call light is right here if you need it, Miss Elephant. I'm going to make sure that you're in a good position. The bed is as low as it goes and locked. I'm going to then do hand hygiene and leave, but right after that I'm going to document the time and date of the procedure, the patient's tolerance of the procedure, the color, consistency, and amount of sputum. What else? There's a couple more things. The vital signs and respiratory rate, and then finally the site assessment around the peristomal site. Alright? And then hand hygiene, of course, before I leave the room.